All right. Item 9 is public comments that are not on the agenda. So if anyone would like to address the council on items that are not agendized, please approach the podium. And if you would like to state your name and address for the record, please do so.
Certainly. Sorry about my voice. I'm getting over a cold. My name is Michael Stevens. I live at 3244 Shelter Creek Lane here in San Bruno. I'm here. My family had to step out for a moment, but my wife and 2 daughters also reside here. And the reason I came was to ask for some help with an ongoing issue that we've been having. We own a condo here in San Bruno, and we're surrounded by a lot of smokers. And even with our home being closed at all times, we keep our windows and doors closed, even in the summer months. My family's still exposed to secondhand smoke on a daily basis. And my younger daughter was the one in the wheelchair. Jillian, she's almost 6 years old. She has cerebral palsy and a lot of related medical problems because of it. And one of the things is, her muscle weakness throughout her whole body and muscle coordination. And that affects her breathing as well. She has no natural ability to protect her airways. So she really struggles with the constant secondhand smoke. We have a pulmonologist who has helped us, as much as we can, with heavy medications, inhalers, and nebulized medicines. But it's been an ongoing struggle for her. Just letting her breathe at home has been such a challenge. And it's very frightening for her. It's frightening for us to watch her struggling to breathe. And we haven't been able to find any relief. We've reached out to our homeowners association and the county health department, and even I've had phone and email conversations with San Bruno Police Department, and everyone seems very sympathetic to us, but unable to come up with a solution. We've reached out to our neighbors and even introduced our daughter and said, you're harming her, you're causing her pain, and we just really have not found a solution. So I'm here to ask for your help in removing the secondhand smoke from, especially the multi-unit residents in our city. We need help, and I guess I'm here to ask for your help in relieving that situation. So.
Okay, thank you for your comments. Any comments from staff regarding this topic?
So I'm sure we all sympathize with the gentleman's situation, and certainly we can have a discussion amongst ourselves as staff and then bring any items forward to the City Council that the City Council should direct.
Okay, thank you very much. And this is a topic that's come up before, and something that the City Attorney and I have talked about before in terms of bringing forth some kind of ordinance that might help in a situation like this. But I guess if the rest of the council is in favor of directing staff to look into that, it's something that can come back to us at a later date.
I agree.
Okay, thank you.
Good evening. My name is Olga Rhythm. I didn't plan to speak. It will be like just a few minutes. I am San Mateo County resident. I live in Foster City, and I am with Tobacco Free Coalition. And I want to ask you, everybody who is sitting in this room, do you know what does it mean to have disabled kid in your family? Do you know what is it? In my previous life, back in Russia 25 years ago, I was speech therapist, and I met a lot of parents. You don't know how hard it is, and only policy can help these kids and this family. You don't know how hard it is. I met family a few days ago, last week. It was heartbreaking meeting. And only strong policy. Why you cannot? Foster City can, Belmont can, Burlingame can. Why you cannot? Why you have to wait for agenda someday? It needs to be done as soon as possible, because if you have heart, you have to do it faster. This is my opinion, and I think when you will have possibility to help this family, this particular kid, other tenants, you will feel relief. You couldn't imagine how hard on the parents, not only on the baby. So please, I'm begging you, help to have a smoke-free policy as soon as possible. Thank you.
Thank you. Anyone else?
Hi, Ryan Mersney of Keynes Avenue. I'm not an accountant, so, but I discovered something in the quarterly financial report, and it says the cable fund has a beginning unrestricted net position of $7,966,000. Staff is requesting carryovers of $1,843,000 for open purchase orders and ongoing CIP projects. The projected ending net position of fiscal year 2015-2016 is $9,930,542. Now, from my understanding, that's actually debt. And I thought the cable company was making money. So I'm a little confused by that. So if that is correct, and that is $10 million in debt our cable company owes, may I ask how that is possible? I mean, where did the money go? Because as I understand, unlike the federal government, you can't, just print more money. You have to make the books balance. Did you write an IOU out of another account, or did you not contribute as much as you need to a retirement fund? I'm just confused at how you can do that. And now it kept going on every year. Because if that is true, and it is $9,930,542 divided by 43,000 residents, that means that each one of us is responsible for $230.94. Now, that's a lot of money because you don't even have to be a cable customer. That means just you're a resident. You could be 1 day old or 110 years old. You're responsible for $230.94 in debt. And how do you keep racking up that kind of debt? And as I understand it, nobody's been fired. I mean, the cable company still has the same management. And that's very troubling because I would think with that kind of job performance, somebody needs to go. I would appreciate an answer. Thank you very much.
Okay. And that particular subject is on the agenda, so we'll be talking about the overall budget,
I didn't
and
know
maybe
that.
we can get a few answers to your questions.
Thank you.
Thank you.
Good evening, councilors and members of the public and staff. My name is Bob Gordon, and I'm a member of the San Mateo County Tobacco Education Coalition. And of course, this is why we volunteer. This is why we do this, and our elected officials are in a place to make things better. And of course, we look at a comprehensive plan to reduce uptake of tobacco and protect our young people especially. And I'm here to talk about a slightly different topic. I'm the leader of a different subcommittee. We're working to eliminate tobacco sales in pharmacies. And we work closely with some community-based organizations like Youth Leadership Institute, Breathe California, with dental hygienists, with dentists, with doctors, with pharmacists. And I don't know, I imagine that many people in this room have lost relatives to tobacco. I personally lost 3 people who I was very close to. One was my grandfather, lost him to cancer. He died before I was born, so I've only heard about him, and I know other people have stories like this. I lost my great-grandfather to emphysema. I remember when I was age 10 watching him struggle for every breath when he was hooked up to a machine, and that's how I remember him. And I also lost my favorite cousin to emphysema. He was given his first pack of cigarettes by the United States Army when he went off to Vietnam. And unfortunately, 42 years later, we did lose him at age 60, much, much too early. So these are some of the ways that the tobacco industry affects us as individuals, as our families, and all of our communities. So our Tobacco Education Coalition respectfully asks you to consider a different type of policy that would make it so a tobacco retailer license to sell tobacco is no longer granted to pharmacies. Now, you may not know, but 8 other communities in California have already done so, starting with San Francisco in 2008, and most recently in Daly City. Now, in Daly City, come January 1st, the 4 drugstores that are currently selling tobacco and currently have a tobacco retailer license, their tobacco retailer licenses will expire, and they will no longer be selling tobacco in Daly City. Now, why work on such a policy? Several reasons, but we know that our young people frequent our drugstores. And when they arrive at the front corner with their purchases, whatever those purchases are, they see a huge wall of Marlboro and Camel, and all of the advertising as well as the packs of cigarettes. It's called a power wall. That's what's behind the counter in these places. Now, community members and their elected leaders do have the power to decide that local pharmacies will not sell tobacco, and therefore the power to change what a pharmacy is for a whole generation of kids growing up in the communities. Now, will this type of policy alone solve the fact that we lose 480,000 people in the United States every year to tobacco-related diseases? There are over 20 diseases. No, and I believe my time is up. So I'll just say I would urge you to allow San Bruno residents to have a say in creating a healthy community and for its youngest and its most vulnerable residents. So thank you very much for your kind attention.
Thank you. Anyone else? Okay. Well